Hello, welcome back to Montech Medical Minds. This is continuation of ICD-10-CM and CPT coding of lacerations. Continue your education to complete the topic objectives. You will be leading by the best trainer in the medical coding. Good luck.
Dislocations will be there. Let us look into one more example. Let's go to the neck. So neck area, where neck is classified superficial injuries, open wound. So open wound of neck, open wound of larynx trachea, open wound of larynx. So laceration without foreign body, with foreign body, puncture wound without foreign body, puncture wound with foreign body, and then open bite, and finally unspecified open wound of larynx. So in neck, we have larynx and trachea, and then open wound of larynx. All the categories you will be able to see it. See the larynx, and then when we go to trachea, open wound of trachea, laceration without foreign body, laceration with foreign body, puncture wound of foreign body, and then puncture wound without foreign body, with foreign body, open bite of trachea. This is how the ICD-10-CM classification will be available. Very simple. When you want to search into, go to the alphabetic index. Alphabetic index will be having a L series category, laceration. Laceration. Here is the laceration. Go to laceration. Then you will be seeing all main subterm, main term, subterm, and sub-subterms, and related to the injuries of this one. And then look into the next option of main term. Go to alphabetic index, open wound. We see wound open, as we discussed here. Wound open. So go to W. Go to W and then go to WOUND, wound. Wound open. Here is the wound open. So again we come to the same thing. Wound, whether we go to laceration as a main term or wound open as a main term, again the start with abdominal wall, all these things available as a alphabetic index order. So if you want to go and check in the tabular index, S series, T series is the injuries and poisoning. Go here, S series, and then specific body part. Go to the specific body part, and you will be seeing here open wound. Open wound. Let's come back. So this is the ICD-10-CM coding path, and how many types of lacerations for each body part is classified, and what and all each and every category. Unspecified open wound, if it is not documented, whether it is a laceration, neither laceration or puncture wound or bite, open bite. So this is the classification of ICD-10-CM. For each body area you will be able to find. And the main terms that you can use is two things. That is, one is open wound and one is laceration. Two main terms you can use to search. Hope it is clear for lacerations of ICD-10-CM coding that we have discussed. So coding of open wound and laceration. And let us look into the CPT coding now of laceration repairs. So once the patient get into lacerations, puncture wound or open bite, yes, of course it is required to repair. Repair means closure of laceration, closure of laceration. So closure of lacerations to be done as a CPT, as a procedure, as a service. So the coder, as a medical coder, need to assign laceration repairs, or it is a closure of laceration. Let's go into this. The types of repair of lacerations, the types of repairs of laceration or laceration repair types. How many types will be there? Simple repair intermediate repair and complex repair. So what is simple repair, intermediate repair and complex repair? So it is very much defined and well defined in our CPT books. What is simple and complex and intermediate lacerations? Let's look into and just go through overview of what are the types of lacerations. So when you look into this, you have all the guidelines. Simple repair. Simple repair is just like a superficial laceration. It is a superficial laceration, just like a superficial cut. It is called. It is only dermis and epidermis and subcutaneous tissue, but without significant involvement. The doctor will repair only dermis and epidermis. It is called simple repair. And intermediate repair. Intermediate repair includes repair of wounds that involves dermis, epidermis, and subcutaneous. That is, a multiple or more deeper layers will be repaired. Subcutaneous tissue includes superficial, muscle, and fascia. Complex repair. Complex repair of lacerations is in deep and it includes the debridement of wound and cleaning of wound, and sometimes it may require multiple procedures to be done like a debridement and cleaning the wound and then doing the complex repair. So exposure to bone, some of the injuries or severe injuries may damage that like complete skin and muscle and then gone in deep with the tendon cartilages, then it is required neurovascular structures also to be repaired. It is called complex repair. So let's look into what are the codes availability. What are the codes availability for the type of repairs like a simple repair, intermediate repair, and complex repair. So we have codes simple repair 120012, 12021, and then intermediate repair of CPT codes 12031 to 12057, 131002, 13160. So let's look into how these CPT codes are categorized. So these CPT codes are mainly categorized based on the type of repairs. Based on the type of repairs. That is simple repair, intermediate repair, and complex repair. Let's look into see the first category 120012, 12021 are the codes for simple repair, and then intermediate repair codes are 120312, 12057 codes are intermediate repair of laceration codes. That means if the laceration happens more deeper and multiple layers may be closed, epidermis, dermis, and subcutaneous tissue, sometimes it is called intermediate repair. When the intermediate repair is done, these are the CPT codes falls from 12031 to 12057. Then complex repair. We have seen what is complex repair. The complex repair is involved more and more deeper tissue, sometimes includes muscle and tendon, cartilage, and neurovascular structures sometimes required to repair. So this is called complex repair. This is called complex repair. And then intermediate repair. Intermediate repair is a repair in two layers at least, epidermis, dermis, includes with that subcutaneous tissue also will be repaired. And then superficial laceration, dermis, epidermis only. It is called simple repair. Hope it is clear what is simple repair, intermediate repair, and complex repair. It is superficial repair. Only dermis and epidermis is called simple. So this is one criteria how the CPT codes of lacerations are categorized and classified.